Welcome to the Veterinary Cannabis Society Coffee Chat Series. Today we're speaking with Dr. Tyler Carmack of the International Association for Animal Hospice and Palliative Care. During the chat, we refer to our organizations as VCS and the IAAHPC. Over this next hour, you'll learn about basic and specific science related to treating hospice and palliative care pet patients with cannabinoids, particularly CBD, CBG, CBN, and THC. You will be introduced to the conversation by Emily Stewart, Development and Outreach Manager at VCS. Dr. Trina Hazzah, VCS co-founder and president, provides most of the veterinary cannabis advice. She's helped by Dr. Sarah Silcox of the Canadian Association of Veterinary Cannabis Medicine, or CAVCM. You'll also hear questions presented by members of VCS and IAAHPC. Stay until the end to learn about how you can connect with these organizations to learn more information. Right, so I'm going to start. I'm asking Tyler to unmute, and I'll just have Tyler introduce the IAAHPC.
I know, it rolls off the tongue. You just have to say it about 1 million times. So the IAAHPC is the International Association for Animal Hospice and Palliative Care, and we're a members group really for the interdisciplinary team, everyone who supports animal hospice and palliative care. Our membership is mainly veterinarians, but we have aftercare experts and mental health professionals really that help round out that interdisciplinary team. And so we are excited. We have Colleen Ellis as our executive director. She is on the call. And then Dr. Karen Christopher is our current president. And I am serving as our president-elect. I have Hampton Roads Veterinary Hospice in Virginia Beach, and we have been practicing hospice and palliative care for about 15 years. That's about the length of time that the IAAHPC has been around now, and just really steadily growing with more interest in hospice and palliative care and expanding our toolbox to really provide the highest level of pain management and comfort care for these pets as they go through their end of life journey. So we're excited to learn a lot more about the Cannabis Society and what's new and exciting in the world of CBD and research.
Cool. And I would like to just ask you a couple more questions.
Sure.
One of the questions I know, because I learned this in the meeting with you and Colleen, is that you are primarily an in-home based care service, correct? So your veterinarians go to people's homes to provide the care?
So it depends. There are a lot of different models out there. My practice, yes, we're, I would say 99% home mobile service. Most of the dedicated hospice and palliative care practices are based on house call visits, but there are more and more general practices that are sort of developing a hospice and palliative care program within a more traditional hospital or an emergency specialty hospital. But all of those that I'm aware of have some component of at-home care as part of their practice model. So it really just depends, but I would say the majority of our veterinarian members who have their own practice or are doing this exclusively do quite a bit of at-home care.
Okay. And then on a personal note, I also wanted to ask you, back in the day, like 2 years ago, I assume, you were a young person looking to go into veterinary medicine. Did you plan on working in hospice and palliative care, or how did that become your focus?
I did not. I was always planning to do zoo and wildlife medicine. I was a marine mammal focused growing up here at the beach. Like every 6-year-old girl wants to be a dolphin veterinarian. And so went through vet school. I went to NC State and did an internship, still thinking that I was going to apply for zoo residencies. And really enjoyed more than I expected working with cat and dog families. Quickly learned during my senior year of vet school and beyond that I'm a magnet for just the terrible cases and the hard conversations, and really ended up in emergency medicine having a lot of those conversations and really just wanting more time and more connection with those families to walk them through that process with a little bit more dignity and a little bit more personalized care than I could offer in the emergency room setting. And so hospice and palliative care really found me. I don't have a patient or a connection that drew me to hospice and palliative care, but I've really enjoyed everything I have learned through the last decade and a half of practice and being able to help these families who are just so very grateful to have somebody in their corner.
That's awesome. Thank you so much for giving this that brief overview of the IAAHPC. I usually have it right, but now that I know 20 some people are listening to me, I'm going to mess it up. So I'm going to move on over to Dr. Trina. Dr. Trina, can you introduce us to the Veterinary Cannabis Society and yourself, please?
Yeah. Hi, everyone. Thanks for joining today. And Tyler, thanks for being part of this. I'm really excited to learn from you and hear what you're doing on the hospice side, because certainly there's a big space for cannabis in that, in that arena. So I'm excited to hear how cannabis can help your patients too, and hear what you're already doing with cannabis. Sarah Silcox does a lot of palliative care as well. So Sarah, I'm excited to hear from you as well, what you're doing, and learn a little bit from kind of what you do from the clinical aspect of it. So my name is Dr. Trina Hazzah. I'm a veterinary integrative oncologist. Similar to Tyler, I kind of started off, one way. I thought I was going to be an internist, and I loved learning about hormones. And then I got hooked, and every case I wanted to see were cancer cases. It just was like the universe brought me to oncology, and I had a lot of support in that direction as well. So I became an oncologist and spent a lot of time doing more conventional work, and then started to realize I just wasn't doing enough with just conventional medicine. So started to integrate more of a holistic practice along with conventional. And it's been really helpful. So I got certified in Chinese herbal medicine. And then during that kind of quest to learn more about herbs, I got really into cannabis, because out of all the plants, that one seemed to have actually, honestly, the most research. Like, there's so much research on cannabis. And to me, I'm definitely a science nerd. A part of me is the science nerd in me wanted to learn more about pathways and anti-tumor activity. And then as I started treating more and more cases with cannabis, I started getting into treating, seizure cases and palliative cases that weren't just cancer palliative cases, renal failure cases and heart disease cases and other ones too, with cannabis, and figuring out the nuance of dosing and really listening to what the pet parent wants. And really, I think cannabis is such a versatile plant that, depending on which cannabinoids you choose, you're really able to support the patient in a very unique way compared to pharma, or maybe some of the other nutraceuticals or supplements out there. So the mechanism part has been really fascinating. The problem, I ran into maybe, 8 years ago or so, was the legality was really an issue for veterinarians, and it still is all over the country. Being in California, thank goodness, there is the thank goodness part that, the Veterinary Medical Board got on it pretty quickly compared to some of the other states. And initially, they were not supportive of using veterinarians even talking about cannabis. They, you could lose your license. So a few of us got together, the vice president, Dr. Richter of VCS, and I, and one of our board members, Charles Lozo, we all got together and really started to think about how are we going to be able to support all veterinarians in this way, because this doesn't make sense. Pet parents are asking vets all the time, every day, multiple times a day, about using cannabis for their pets for a variety of conditions, and they're terrified to be able to even speak about it. So we, really came together from an advocacy standpoint initially to build this 501c3 nonprofit veterinary cannabis society. And it made sense that we first just came out to really give a voice for veterinarians, so they had a legal place to be able to really talk about cannabis, support pet parents without fear. And what we realized, and when the survey studies came out and so forth about veterinarians, it wasn't just the fear, it was they didn't have the knowledge, because none of us learned about cannabis in veterinary school. So we put VCS really started to develop into more of an advocacy and education nonprofit, where we felt we needed to build the education and the advocacy both to support veterinary professionals as a whole, because many of the laws pertain to veterinary technicians as well. So we wanted to really support them, and then educating pet parents in the industry about cannabis and the way, the safety and the harm reduction ideas, and supporting them kind of fully is really how VCS started to develop. And we've been around now for 2020, so 4 years. So I still consider us a baby organization, but a very powerful baby organization. We have a lot of heart, and we really believe in our mission and our vision to really, empower and educate and advocate for all the veterinary professionals, the pet parents, the pets, and the industry when it comes to, pets and cannabis. So I'm really excited to be here, and I really love, I'm so grateful really for, you, Emily, for getting us together with Tyler, and because this is a talk that needs to happen, and so I love the idea of getting it out so others can hear about the way that we can use cannabis for palliative care and our pets.
Thank you so much, Dr. Trina. Thanks, you answered all the questions all at once. So I really appreciate that. That was a great overview. So already we've started to see some of the ways that our two focus areas coalesce, and we will jump more into that. But before we jump into listening to Dr. Trina and Dr. Tyler dialogue for a little bit, I'd like, if possible, I know some of you are doing other, you're multitasking, which is fine, but if possible, if you can go into the chat box and just chat your name, and this is for everyone to see, so not a direct message, make sure that you've chose meeting group chat. If you can chat your name, your location, we have your names here, but just so we can see in the chat. And then whether you come to us more from a palliative care background or from a cannabis background, if that's applicable to you. Of course, the answer could be neither, which is fine. You could just be a pet parent or a good citizen. And then if you can say, if you already have a question that you'd like to ask Dr. Trina, Dr. Tyler, please go ahead and chat that as well. Just note that, a lot of the people involved in this call are acting veterinarians with acting consultancies that you can book meetings with if you have a dog or a cat or a lizard with specific needs. So we won't kind of get down into maybe so much of the nitty-gritty of, say, dosing and specific issues today. You're welcome to ask, and maybe we can answer something, but I'd like to keep it a little bit higher level if that's possible. So go ahead and take a moment now, everyone. Find that chat. It's under the more, you'll see the more button with the 3 horizontal dots, and that's where you can see that. There, I've just chatted to everyone. Take your time to do that, and then we'll go ahead and get started. Thank you, Julia. Julia from Kansas City, palliative care veterinarian. Awesome. If you're already a member too or a sponsor, go ahead and mention that. We have a couple of sponsors here. Okay, we've got Erin, Hospice, Palliative Care Vet Nurse with Caring Pathways, awesome. Colleen, Executive Director of the IAAHPC, Breckenridge, great. Diana is in Houston, she does Hospice. Sandra in Switzerland is one of our board members. Cannabis Clinic, Dr. Sarah, who I already mentioned, is the Director of CAVCM in Canada. She does a lot of Hospice. Chelsea, General Manager of Caring Pathways. Good to see a couple of these Caring Pathways folks here. We've got Milwaukee, Elka Rudolph with Blue Pearl Pet Hospice. Got Hospice Care in Colorado. We've got Nancy Stewart. Yes, Nancy Stewart is my mom, so that's cool. We got the whole family in here today. So awesome. Well, thank you all so much. I know Michael Pickens is also here. Michael Pickens has a cannabis pet product organization. I know he just went through a rebrand. Jeff Pollard is one of our board members and our advocacy committee. Thank you so much for joining us, Jeff, today. So feel free to keep chatting as we go, ask some questions. Now you know where the box is, and let's go ahead and get started. So I'm going to double spotlight Tyler and Trina, but just a reminder, please feel free to say anything at any time, ask questions, comment. We're welcome to hear your stories of experiences you have had related to cannabis or hospice and palliative care. We're welcome to hear all of that. So I'm going to remove myself. I'll only ask questions if the conversation seems to, need it. But I will start right away. When we first spoke about this meeting, Tyler, you had mentioned that you personally walk into a lot of people's homes and you see that they're already using CBD, but you're not sure if they're using it in the proper way. Can you tell me a little bit more about how you see CBD being used and how you wish it was being used? And Dr. Trina can comment along that line. Oh, sorry, you're muted. Yeah.
There you go. So Dr. Trina, to your point, 10 years ago, I used to walk into homes and they'd kind of feel me out a little bit. And then they'd go to a drawer and pull something out and be like, well, I'm also giving this. And my vet doesn't know. I didn't want to tell them because they were afraid of being fussed at. And so thankfully now it's a little bit more out in the open. Sometimes it's because of the recommendation of the veterinarian. But it's still not uncommon for them to pull out a bottle of something that I have no idea what it is. Sometimes it's from the corner, smoke store or gas station. And thankfully, more and more, it's brands that I recognize that have some veterinary research behind them. But I think I struggle with knowing if it's an appropriate product, if it's one that they're utilizing in the correct way in terms of dosing. They all seem so very different. And really starting to have that conversation about how we can encourage them to continue using CBD, but maybe transition to something that we at least know is a little bit more reliable.
Yeah, no, I get it. I did in the same situation. I remember exactly how that was. They would definitely feel you out and make sure you were cool. Like, is she going to be cool with it? Oh, she's going to be cool. All right, I'm going to tell her. And then I get, because I'm in California, so I get the array of products. I get like, here are 20 of them that I have. And I'm like, all right, let's go through them. So I think first and foremost, is it a safe product, right? Like that's, I think the most important. Is it going to be efficacious? Honestly, who knows? I think it's so personalized. There's so many different ways to dose, and we can talk all about that. But really, is it safe? I mean, at the end of the day, I think that's the most important. And the best way I always say to tell is go to the company's website and see if there's an available certificate of analysis. And that essentially is a third-party lab report that gets posted onto a website. And you want to make sure it's third-party and it's not the company that's actually running the test, but they send it out to a laboratory that's not related to them. And they run a series of testing, including contaminant testing. So are there pesticides and are there heavy metals? And there was an interesting study published in like 2018 through 2019, maybe it was 2019 or something like that, where they tested, it was 29 different over-the-counter hemp products, and 4 out of the 29 were positive for heavy metals. And they were specific for pets. They were pet products, and 3 out of the 4 were positive, and not just positive, but large amounts of lead. So, I think that when we're treating for any disease, especially chronic diseases, so for long-term, exposing a pet to heavy metals long-term are going to be more problematic than the condition sometimes. So we want to be really, really careful about if there are contaminants. And then the other thing you get from a certificate of analysis that honestly is, I would say, second important is, does the label match what's actually in the bottle? And so the potency of each cannabinoid will be in your certificate of analysis. So you'll be able to say, okay, they're telling me that there's, let's say, 300 milligrams of CBD is very common. So I'm going to come up with that. 300 milligrams of CBD in a 30 ml bottle. Very common, a 1 ounce bottle. Well, if that were the case, then you should have 10 milligrams per milliliter, right? And if these certificate of analysis come back with things like, 2 milligrams per milliliter. And then you'll say, wait, that doesn't make any sense. They're selling me 300 milligrams in this bottle, but really there's only 60 or whatever it may be if it was 2 milligrams per ml, right? So making sure that matches, and that includes all cannabinoids, including THC. There was an interesting study that also came out not too long ago, a few years ago, that showed that all these products came out and they were calling them their pet products, and they came out full spectrum, meaning that they normally have multiple cannabinoids, including THC, and many of them had no THC at all. And others that said they were broad spectrum, meaning they shouldn't have any THC, had THC. So it became this complicated. So you have a dog that shouldn't be, intoxicated, and the owner's like, why is my dog walking around like they're a little drunk, or they look dysphoric, or they look a little, they're urinating on them, so whatever it is. And we think, God, that shouldn't be the case. It's a CBD isolate. It's only CBD. Be unbelievably rare, almost impossible. But then you get a certificate analysis and guess what? There's THC. So I think it's very important to know safety and then potency or accuracy of what's in the bottle. So that would be the first thing that I would do. And if you go on, Tyler, and I share, like I left only oncology, and I do my own practice called Green Nile Incorporated, which is a cannabis consulting service for pet parents. So pet parents all over the world can call, and I literally walk them through the entire process for whatever disease process they have. So they just go to greennile.org, they make an appointment, and then I literally share my screen because we're doing it on Zoom. Oftentimes I share my screen. I'm like, let's go check out, because I've never heard of this company. Let's check it out. I'm not against it. I'm product agnostic. Let's just check it out. And then I'd say, God, I cannot find a COA. I have now looked through every nook and cranny of this website. I can't find anything. Let's not use it. Let's not use it. I can't confirm safety. Let's find something that we do have safety and we do have some, potency information. So I guess I would say, Tyler, if you can't find a COA, and the owner, what I'll oftentimes do is ask an owner to reach out to the company and ask for it. Some companies will say, I'll give it to you if on request, but that's where you get to test the company a little bit in their customer service. Are they picking up the phone? Are they responding to emails? If they don't pick up the phone, if they don't respond to emails, then just walk away. It's not worth it. I always say it's never worth it. And so when they bring out all those products, you can walk them through a little bit going on and, on the sites, and I just educate them as much as I can about that point. And then tell me more of your question. Was there something else?
No, I think that's probably the biggest thing. And then just the range of dosing, which is going to depend on concentration and that kind of stuff. But my takeaway would be that if a company is really confident about their product, that certificate of analysis should be front and center, right?
Front and center. And it should say lab report. They say lab report, certificate of analysis, COA. You'll get a bunch of stuff and you click on it and it should be exactly there. And I think reputable companies will have that. At this point, most of the vets that talk about cannabis were all hammering and need. There's no proprietary anymore. Oh, the other thing I guess to monitor too is the inactive ingredients. Right? That's the other thing. So when you go to their website and you're looking, the COA may not have inactive ingredients, but the website should list what the ingredients are. So determining what's the carrier oil, so I'll give you an example why that's important. Probably, I don't know. I keep saying 2018 is when most of the studies came out. So between 2018 and 2020, probably 19 or 20, there was a dose escalation study done in cats where they gave them it was CBD THC dose escalation. It was incredible how high they could go. These cats could go on THC. It was 42 milligrams per kilogram dose. It was super high, literally, So, but what was interesting about the study is a bunch of the cats had GI upset, ton of them. And they found most of the cats that had GI upset were on placebo. Mm-hmm. Right. And so then the question becomes, well, what was the placebo? Right. And it was MCT oil. So, why is that important? Well, if I have a cat patient And let's just say it's like every cat patient I see over the age of maybe 14 or 15, they almost all have some chronic GI disease. They have some kidney, their appetite's a little bit picky, right? Like these are all kind of common things we see in older cats. And so I'm a little nervous to find a product that's MCT based and then use it knowing that study exists, right? Just using science to help kind of guide us. And so what I'll oftentimes do is look at what the inactive ingredients are, including the vehicle that the cannabinoids are in. And if it's that MCT base for cats, doesn't mean every cat. I have some cats that do great with MCT, but just it may make you think if you're deciding between two, right? The ones that the study drug came in that paper, it was sunflower oil that was really well tolerated in cats. But there are others. I use sesame oil in cats. I use others, and a lot of times they do really well. So knowing the vehicle can be important. And then if it's a human-based product, which I use a lot with Green Isle, I'll send them off for human products. And some of the really high quality ones are human, made for humans. One of the things you want to make sure is people hate the taste of it's the terpenes in there that are creating some of that taste. And people just don't like it because they have to hold it in their mouth and then swallow it and it can sting and they don't like the taste. So a lot of times there's xylitol in those products. And xylitol is the artificial sweetener that can be really toxic to animals and can cause liver failure in dogs. So we want to be super careful that there isn't a xylitol in a product, right? So you're looking for things, if it's a human-based, there's no xylitol. I just stay away from all flavorings. There's one company I use that has what they call natural or peppermint. And I'm like, your dog is going to hate me if you give you the peppermint one. So can you pick the natural instead? And cats, as we know, are way too smart. If you gave them peppermint, they would like pee in your shoe and probably pee in your bed at night. If anyone has a cat, they'll understand that joke. So I think it's important to really look at what those other ones are. Obviously, no chocolate or, certain nuts and things like that, macadamia. And so you want to be careful if you're picking a human product, what else might be in there in the inactive. Does that help a little bit too, Tyler?
That does, yeah.
Okay. Dosing wise, and then you can shut me up because I'll just talk for years and years.
No, I'm taking notes.
Okay. For dosing wise, I think I'm imagining, tell me a little before I answer that question fully. And Sarah, if you want to pop in, feel free to, because I know Sarah's got a bunch of experience too with cannabis for palliative care. Tell me just a little bit, Tyler, about the cases you see, age range, typical conditions, things like that, because that helps a little bit in dosing.
So I would say we're strictly hospice and palliative care. So, 95% of our cases are geriatric, lots of comorbidities, arthritis, different types of cancer, and then just general aging changes, cognitive changes, those sorts of things would probably be my three that are often on it already. So just a chronic arthritis patient that's been using it for a while, a cancer patient that's had it added in, or just kind of our general aging, cognitive decline, trying to get some more sleep usually.
Yeah. And are they on just a CBD isolate usually, or I'm guessing?
A lot of times, we'll see a good amount now of our arthritis patients on LVET, or have started with LVET and may not continue purchasing it, but switch to something else that they can get a little bit more locally. And then I would say these days, they usually are on a pet specific product. I'm in Virginia. There's a few members of my Colorado team in here that can share. There's probably a lot more just available in Colorado and some other states. But I feel like it's just kind of a generic almost from one of our pet stores or one of the kind of wellness lines that they've picked up, assuming that CBD is CBD and does everything.
Yeah. And we know that's not.
Yeah.
The molecule is the molecule for sure, but there can be profound differences in the efficacy if you have a CBD only product and then a full spectrum that has other cannabinoids in there. Oftentimes, what at least what the studies have shown too, and there's an interesting study on pain, looking at the difference between and a few on cancer in vitro, like cell culture studies, where they've shown that full spectrum can be more efficacious than oftentimes is more efficacious than isolate. And also the chance of side effects is actually higher for isolate than full spectrum. They tend to balance each other out a little bit, and they require a whole lot less of a like dose wise. So you can give a lot less of a full spectrum to sometimes get more efficacy than you, or equal efficacy, but you'd have to give so much more of the isolate to make that happen. And sometimes you can get more side effects from that. Sarah, jump in.
Yeah. From a palliative perspective, I find that usually I'm seeing sort of two different groups. One are people who are reaching out for a cannabis consultation. Oftentimes those pets are nearing end of life, but we still have some time to work with, whether it's an epilepsy case or a poor mobility case, chronic pain management, cancer management. And so those are sort of the one group where we have that time to go over. A lot of times I'm going into the homes and meeting people for the first time during that in-home euthanasia appointment. And we have a questionnaire that they fill out that asks what medication the pets are on and, if they want to pursue further, discussion or treatment. And most of the time people are like, no, it was too hard. We don't want to talk about it. And they'll have CBD listed. Just CBD, no product name, no dose. Sometimes I'll see it in the medical records as well, coming from the regular veterinarian and sometimes even the specialists, where it's just listed as on CBD. And it is my biggest pet peeve. Well, actually, no, not my biggest, but it's one of my biggest pet peeves, because we would never dream of putting in our medical record, patient is on an NSAID. Which NSAID? What dose? How frequently are they giving it? And yet that information is just skipped. And again, I think it hits on your point, Trina, that most veterinarians out there just don't have the education and the awareness to know what questions to ask. A lot of times when I've gone out, people have said, well, we started them on the CBD and it worked really well at first, but then we just found it wasn't working. And it breaks my heart when, I'll really gently ask questions about what they're giving or how much were they giving. And we have so much room. We could have moved on the dose. We could have chosen some much more appropriate product. And I'm not going to tell them in that moment, that was a totally wrong product to use. We also have, even though we have the legal market in Canada with a whole array of products that would be suitable, a lot of times pet parents are still being drawn to the black market pet products that have the paw prints and the little doggy silhouettes on them. We don't know what's in them. One of my appointments last week that was an actual consult, and it said on their intake form they were using CBD, but it's a product called CB2, which is really just beta caryophyllene supplement. So it's not horrible, but that's not CBD. So then we had to have a whole discussion about what that meant as well. So a lot of the same indications, I find pet parents are looking for cannabis products, but they're not getting the appropriate guidance that they need. And in a palliative situation, it's so important, because otherwise I'm out there for that final call. So, I know when it comes to dosing too, when we have the luxury of time, most of us like that start low, let's see how they do, let that endocannabinoid system tone up a little bit, then we'll start increasing the dose and titrating upwards. Sometimes when I'm getting these calls for palliative care, we were considering euthanasia, but someone said we should talk to you about cannabis first. We'll give it 2 weeks.
Oh, wow. That's great though. Gives you a little challenge. Gives you a little challenge there.
So I tend to titrate a little faster.
Yeah, I can imagine.
And
what ratios do you tend, this will be important for Tyler too, and everyone listening, like for those palliative cases where, let's say you have 2 weeks, right? What ratios do you typically use? And when I say ratios, and Sarah, you can talk a little bit about what that means, if you like.
Yeah, so the CBD THC ratios, and I find a lot of it is so dose dependent. and patient dependent, because if they're on gabapentin and they're already really wobbly, then I probably am going to be extra cautious about starting the dose higher or adding in a product that has THC or CBN. So I might use something that's more CBD dominant. But I will fairly comfortably use a 25-to-1, and then even a 10-to-1 if we're pretty comfortable with things as well. And I just let clients know that everybody's a little individual. So monitor, use that template that we give them with the daily tracking record so that we can see how they're responding. We'll adjust their dose accordingly. But it's usually somewhere in that 25-to-1, 10-to-1. And then a lot of the kitties, I'll start with an isolate just
Yeah.
because they so hate the terpenes. And then if they're doing okay, then we might work up to something a little bit more broad spectrum.
The other thing people can consider doing too is like use whatever product you have, right? Just to get going. And then you can always add in another product. So I've started to do that too, where I'll be like, well, you know, it's more of a broad spectrum, or it's a full spectrum. It has THC, but it's a 50-to-1 or it's a 30-to-1. And they have it, they already ordered it, whatever it is. I start them maybe a little bit higher on the dose, but then but I don't want to overshoot what might work too, because with cannabis, it's that biphasic dosing curve, which really means that your optimal dose is somewhere kind of in that middle range. If you give too much, it's going to not work. If you give too little, it's not going to work. And so you finding that dose, I find that if you overshoot it, you've kind of screwed yourself. You have side effects and it's not working. So the start low, go slow works. Maybe just start lower, go faster, you know, like for your palliatives cases. But I sometimes just add in another product. I'll say here's like this is a 1-to-1 CBD THC product. I'll add like a drop of that to whatever the 25-to-1 or the 10-to-1 or whatever it is. And I find for the palliative cases, depending on the case, depending on their age, their comorbidity, stuff like that, a bit more THC can be so helpful. Like it just is like, and I think they wouldn't even know it if you didn't try it. Like the CBD isolates, some cases can work, but I find you need some THC to really, if you look at mechanism of boosting appetite, right? Like CBD isn't going to do it. Like CBD has no mechanism behind how that would work. It's THC that can work. If they're nauseous, CBD could be wonderful and reduce nausea, it could reduce pain, and therefore get them to eat more, but it by itself is not an appetite stimulant. And if we're going to get appetite stimulation with any cannabinoid, it's going to be THC, in my opinion. There's some research on CBG, but I don't believe it. I've just not seen it. And it's not that common we get the munchies in animals, but when we do, and they're at the end of their life, it's like the best thing in the world. It's like you hit the jackpot, because they also get a sense of euphoria. That is the reason why, if you look at a lot of these palliatives, clinical trials in people, why there's been, 90% have success and they're feeling better, right? It's sometimes it's a perception. It's truly just perception. They know they're dying. They might even still have inflammation or have pain, but their perception of the whole process changes. And we see that in animals. They're like, he like picked up a ball and started playing. But he only had 2 days left. I don't know. He hadn't walked, and you're like, that's like cannabis for you. Like that is why people use it at the end. And I think animals deserve that same right, and I think THC in those cases tend to do a little bit more of that type of magic, at least in my experience. But I don't know, Sarah, if you agree or not.
It's so funny you said that about perception. I remember reading a paper that came out that was sort of a down on cannabis, and it was, studies have shown cannabis does not reduce pain. It only reduces your perception of pain. I'm like, but if you're not perceiving the pain, then where's the pain? So where does pain occur? Does it occur in your brain, or does it occur at the local site? And I asked a friend about that who uses cannabis for MS, and he paused. He's like, wait, say that again. He's like, no, you're absolutely right. Because without cannabis, I'm miserable, grumpy, and you don't want to be around me. When I consume cannabis, I can function, I can play with my kids. But if you ask me, do you still hurt? Yeah, I do. But it's not weighing on them in the same way. And it really comes down to that quality of life. So I agree with you. Yeah.
So that makes me feel better because I haven't experienced the magic, so to speak. And this may put me in the real newbie category of questions here, or may just be telling of my state. But do my clients have access to THC products? Because my Colorado clients probably do, and in California I get, but I guess I haven't actively sought them out. Not that I'm necessarily worried about the precautions, but we just don't have them available locally. And so where would I start looking at products that do contain THC?
I mean, I think, Sarah, I'll take it, because US question. I'll take the US question. A lot of the hemp-derived products that they can be, like, they can just get in the mail.
Okay.
Have THC. Some of them are heavier in THC than some of the ones at a dispensary, to be honest with you, because legally you can have up to about 3 milligrams per milliliter of THC, which is a slug. That's a lot. That's a big dose for an animal. So that's, that's that 0.3% THC limit for hemp. So yeah, you can find some companies that have low ratios, like a 4-to-1, where sometimes you don't need all that CBD, especially at the end. You need a little bit, but I think having that, even just the smallest amount of a low ratio product, you'll be like, oh, wow, that made a big difference. The one drop, because I've tried high CBD dominance, they're like not getting much. And like, go to the dispensary in states that, go to the dispensary, pick a 1-to-1 up and give just it looks like Shalisa is writing from one of her companies, and they from her company, Furry Faces CBD, and they have a 0.03% THC product. But there's tons. Yeah. You could go check her out there. There's lots of them out there. And Tyler, you can always feel free you can send folks to me, obviously, but you can also just email me and I can give you some thoughts too about, maybe a lot of the human companies, they'll have it. I don't think there's recreational cannabis in Virginia. Yeah, I don't think there is either.
Sadly, no.
Yeah. Is there medical?
Stuck with my coffee. We do very recently have medical, but I have not seen a whole lot of action there. I'm sure in maybe Richmond and the bigger cities, but it's still a difficult process here.
Okay. Yeah.
But that does make me feel better, because one of the areas where I wish I could help more is with appetite stimulation, and I just don't feel like the CBD products that we traditionally use get me very far there.
Well, and there can be, because it's all mostly CBD. And so unless they're in pain or they have a lot of nausea, and even then, like if you look at the studies on, a lot of them are chemo-induced nausea and vomiting and things like that. It's very interesting. Like there's not any on CBD. It's all THC or synthetic THCs that are FDA approved, where they've evaluated it. And if you look at just like they've used mouse models and things like that to look at the anti-nausea effect on different cannabinoids, CBDA has like over 100 times stronger anti-nausea than CBD does. So that's where you're like, well, I don't need that much Alvet, but maybe a little bit to bring in some CBDA. I don't think you need much. You need just a little, and the absorption of CBDA is significantly more than CBD. So you don't need a lot in dogs. We're talking about, and cats, actually, there's that one cat study, but it didn't really tell us that much about CBDA, but we know CBDA generally in people and animals seem to be much more bioavailable. And then I was going to say, using them in concert with pharma, anti-nausea, I found successful, because I think there's overlap in some mechanisms, like on Dancitron, right? So Zofran is a 5-HT3 antagonist. So is CBDA, and they both work they can work really well together. So I use that, like those together, and then THC works on CB1 receptors to reduce nausea. CBD works on serotonin 5-HT1A, receptors. So in a way, I look at it as like It's like a party. Everyone's working on different receptors, because I think we all have seen patients where you get substance P inhibitor, so Serenia working, but Zofran never works. And then you're like, oh, try Zofran. Like, oh my God, they're not nauseous anymore. And Serenia doesn't. So I kind of think of tapping on different receptors and trying to have the same impact. And if there can be an additive or synergistic effect, why not use them together?
I'm going to interject here. We had a quick question from Sandy. Sandy is a VCS member, and she asked me a question, but I said, you should ask it to the group. So Sandy, thank you so much for agreeing to ask to the group. Go ahead and ask your specific question.
Hi, everyone. So great to see you. My question, Dr. Trina, is if you have experience working with some of the senior pets, specifically dogs that have the canine cognitive dysfunction or the sundowner syndrome, and what product profiles you have had success with and dosing around that.
Yeah, no, that's a great. I think all three of us have had lots of cases like that. I think what I'm trying to think is it's all over. Like I've had some CBD dominant products work for it, but I would probably tend to go on a little bit of a lower ratio, like 10-1 and above. I wouldn't, even some of the 6-1s I've seen work for it. It depends on the patient, because some of those THC can really put them off their rocker at that point. Like if it's too much THC, it's like the person, that if they ingest too much THC, they're like extra paranoid and they're more restless and they're pacing. We see it in dogs and you're like, ugh, where sometimes the THC does the opposite depending on the amount for that particular patient. So I find that having some THC in the product is helpful, but ratio-wise, I would definitely go over 10. I would probably stick to more than 10-1, although I've seen a 6-1 work in some of those cases. The ones that maybe don't respond. So I would start with a higher ratio generally, and then if it's not working, then start to bring in a lower ratio product. But I've absolutely seen it work. I mean, like when nothing else, they're on all the neuroprotective stuff and the Senolifes and all of that, and they're staying up all night. And the one thing I will say is, like from a Chinese herbal standpoint, cannabis is a hot herb. It just is. It actually kind of takes up the yin a little bit, and so it creates a little bit of heat. And so I have found, especially THC, I just think it does. So sometimes these dogs are already hot. A lot of them are when they're pacing and they're anxious. So keep in mind, it may require like an ice pack also in the middle of the night with it to kind of, sometimes I'll have to add that in if some patients end up being a little bit more hot. But yeah, I think I think that cannabis should be one of the top like first lines for cognitive like sundowner syndrome compared to what's out there right now. I think it works better than what's out there. Sarah, Tyler, I don't know if you all want to say something.
I started my mom on it when she first developed Alzheimer's, and we use a CBD dominant in the morning and then a 3-2 CBD THC for her at night. And the staff at the home where she's at now is always commenting just how lovely and pleasant she is. I'm like, that's not the woman I grew up with, but that's the drugs. But it works for her. I agree with you. A lot of the dogs that I see from a Chinese medicine point of view, I think they're yin deficient. And I often equate it for the parents as very much like menopause, right? Hot flashes and restless and whoo. So the cold bandanas, like the wet bandanas and a fan, are always on my list. I was going to ask Trina, do you use any CBN in your product? Because here in Canada, we have a growing number of products that are CBD CBN or THC CBN mixtures, and sometimes with custom terpene profiles for sleep aid. So I know I've used those sometimes for patients as well at night.
Yeah, I mean, I would have more hope that the custom terpene profiles that have a lot more linalool and myrcene likely that's what they would probably have, would be more effective than the CBN. I think CBN is a fad. I don't know, it's my opinion. I think it's a fad. I think like it binds the CB1 receptor, but like 1,000 times less affinity than THC. So you're asking CBN to do a whole lot. Why not just use a little bit of THC? The fad is all about it helps with sleep, but the studies in like 1976.
It's the terpene mixture in the high CBN products. Yes.
That's probably what's doing it more than the CBN. I think that CBN has some pretty cool anti-inflammatory properties. Actually, there's some cancers that can respond. It can, inhibit P-glycoprotein, which can help with cancer, resistant mechanism. Like there's some other really cool things about CBN, but the sleep property, I think is probably I think THC would be more effective. So then why put it in, like I wouldn't use that as the big thing. That's what I think.
I had a client that was very THC adverse. So we have a broad spectrum product that we're using, and then we did add in some CBN, and I agree with you. It didn't really do what it should have done in the big scheme of things. But having said that, I was curious about your dosing as well, because we are getting some effects, but I think with this client, I'm not sure if I will get her to that point where she wants to have a bit of THC in the product. So that was one of my questions around dosing, because again, this has been, for her, she just really, really THC averse. So, we're trying to work within that window of certain cannabinoids, but not perhaps getting to that point, but we'll see. We'll see if she
you could try to add CBG. There's a lot of research now on CBG. I think CBG.
This product does have CBG in it.
A ton?
Yeah, it has it's a 20 milligram product. So yeah, it's
good. Yeah.
What we can give.
Yeah, there was a study that just recently came out on the anxiolytic and the sleep effects of CBG. Also looking for terpenes, tons of them, just put a bunch in there for sleep. I think you probably have to go really high on your CBN maybe to see a difference, is my guess. You could try to dose, certainly just try to dose higher, double your dose and see what happens. If there's no THC, the likelihood of side effects is very, very low. So you could try to climb the doses high. I sometimes find that if you climb the dose really high, you just get side effects, the product's just not going to work.
Yeah.
That's how I determine it. If you get side effects before you get positive effects, and Tyler, this is kind of important for you too. Like an owner's like, I climbed it, I started low, I went slow, I did this, and you got to the maximum dose, and the dog now is having diarrhea or, having an issue, but there's been no positive effects, and the product isn't going to work. It's the cannabinoids, the terpene profile, the full thing. It doesn't mean cannabis doesn't work for the dog or the patient. It just means that product isn't working. And so you just switch it up, and maybe you don't have to worry about the THC, but maybe you do like a CBG, low CBD product next time, Sandra. You kind of, all of us are so uniquely different DNA makeup wise that I believe our endocannabinoid systems therefore are so different that how we're going to tolerate each cannabinoid and which ones we actually need are so different. This is why I think cannabis will always be more of a personalized approach. It's going to be very hard to have a one size fits all.
Yeah, great. Thank you.
Yeah, thank you.
Thanks, Sandy. That's a good question, because to Dr. Sarah, to your point, that's another high pressure situation for our palliative care patients. We sometimes don't even get 2 weeks if we can't get them a good night's sleep. So I'm taking away from this, I need to sprinkle my THC in there.
It's amazing how well we've done as a profession of educating clients about the dangers of THC. We've over-educated them, because now when we're trying to introduce the tiniest little amount, they're like, I got the product you recommended, but it says it has THC in it. I'm like, yeah, I know. It's
just a little bit. But I'll give you an example. I had a case yesterday, the day before, through Green Isle, and this little older dog having some dementia signs, and she was a little bit averse to too much THC. So I started this dog on 0.075 milligrams of THC. Okay. I'm like, I on purpose started really low. I'm not kidding though. I got an email saying, I don't know if my dog is a UTI, but he's like, have to put a diaper on, he's peeing. And I was like, oh my God, he's so sensitive. Like mom was right. Like mom's always right. Like the pet parents, they always know. Like it did not, their gut feeling is like right on. And I'm like, it's like just a little titch. And it was like, he's already having, and I'm like, I don't think he's got a UTI. I think he's just super sensitive to THC. So I think the sprinkle that you're talking about, Tyler, like start really low. And then there's some I could start at 0.5 milligram and they're like, oh, they're perfectly fine. They're running around, you know, and one's a Chihuahua, one's a Great Dane, and none of it makes any sense from a size. None of it, you know, age, I think is probably where you for palliative care, you're seeing older. I think age is probably more indicative than size. I think an older dog is just going to be more sensitive than a young dog, but you'll never know until you try. And now I'm like, God, like, okay, try to start at 0.025 mLs, and then let's just put 1 drop and let's see, you know, like, and we'll find it. We'll figure it out for that patient. So, you know, remember there's no known lethal dose of THC. So there's the study showed it's at least over 3,000 milligrams per kilogram for dogs. So you know, unless they have like liver failure or even some of the heart failure cases, some of them can still do well if dosed appropriately. Yeah.
So I want to just point out, and this is always the issue with our coffee chats, is they feel like they could go on for so much longer, but we're all also working professionals, most of us in literally working hours right now. So we will draw this conversation to a bit of a close. I do have a couple closing things to mention, but I wanted to open the floor up for any more questions or comments. Like, we're also happy to hear if you have stories. Yes, Shalisa, go for it.
I'm really curious. I've been having a lot of people contact me that are here on vacation from Canada, and they want to know how to get products in Canada, because I know what 1, 2, 3 of you are in Canada right now, and none of them can find really safe products in Canada. They want me to ship products to Canada. I cannot ship products to Canada. I have been talking to Health Canada a lot, and I'm trying so hard to help, but I can't. So do you guys have any people or where I can send? Because I knew Sandy, and we talk about some of the companies that have closed in Canada already that she was working with, and I was trying to get some CBD there for her, but that's impossible. So do you guys have recommendations to tell people? Because so many people contact me through my consulting company and through my CBD company, and where I live is a very transient place in the Bay Area. And so I run into so many international people, especially from Canada. So if you could help me out, where I could send them, or I send them to Sandy if I hear from them, or just a product they can take.
So a lot of it's going to be where they're coming from, province-wise.
Okay.
Because each province regulates their recreational cannabis a little bit differently. Some it's fully privatized, some it's government run, sometimes it's a hybrid system. Here in Ontario, when legalization came into effect, municipalities had the option to opt in or opt out of having retail stores in their town. My town opted in. There is a cannabis dispensary on pretty much every corner. There's more cannabis than there are beer stores or liquor stores. The next town over opted out, but as soon as you cross the border, you're back in Oshawa and there's cannabis everywhere. So, in terms of retail stores, they are everywhere. They're going to be products intended for human consumption.
This is my problem.
Right? So anything in Canada that's marketed for pet use is a black market product.
Correct. And also too, just like here in the States, like I work with all of the dispensaries in my local area, and they have to carry a THC product. They cannot carry an industrial hemp product. They just can't sell it. It's just impossible. And the problem is they only carry vet CBD, and we're all familiar with that. It has a very high concentration of THC, which for the small animals, it's too much. It's just way too much. And so that's why it's hard when I try to tell, I'm looking for an actual brand maybe that I can recommend that they can get in Canada, because I understand the problem of them going into the dispensaries and actually getting a product that would be beneficial for them, not knowing all this education. So maybe a product that you guys could recommend in Canada that I could tell them, because I actually had 5 people just this weekend come to my booth from Canada. It's crazy.
I mean, again, which product I choose is just so patient specific.
I totally understand that. Okay,
there's-
I'll just
yeah.
send them then to you guys. You know, I'll just give
It's
them your guys'
probably-
information.
Yeah, probably the best bet. I mean, Sandy, you guys have MetaPharm, right?
Yeah, we have Medifarm.
I know both Connie and I use a lot of MetaPharm products, and they have a 25, a 50, and 100 mg per mil. The THC ratio in that one recently went up a little bit. So now it's about a 25, like it used to be 100 milligrams of CBD to about 3 mgs per mil of THC. Now it's 4.5 mgs per mil of THC, but it still falls about that 25-to-1 ratio. And it's more of a full spectrum product as well. So if that sort of matches the case, then that's one that's available pretty widely throughout Canada. I think Jamie still has a hard time finding it in the Yukon and has to send people to BC.
What
Yeah,
about
the only reason I was asking for a specific product was because of the fact that I just want them to get a safe product in Canada. Some people won't take the extra step to reach out to you guys just because people are lazy. So that's why I asked for if there was something I could just recommend. So thank you so much.
what about Mellow by Mellow? Do you guys use that? I use that when a lot of my Canadian clients, like they make appointments, and have you used that, Sarah?
I haven't.
Yeah,
No?
Mellows on the gray market as well. Yeah, so they have like pet products, but they also have human products. And then there's another company called You Feel You. So it's the letter U and then feel and then the letter U. They're also available online, but they recently transitioned out of Alberta, so they're only available in Ontario right now.
Okay. Yeah, I use a lot of the Mellow one because they have a cool like CBD product, but it's very little THC. They have COAs, which makes me feel a little bit more comfortable.
I remember we had discussed the Mellow products a lot in chat room because I know some of our VCSs were using those products, but because they're not in the regulated market, it puts you in a real quagmire in terms of recommending a product that's not legal.
That makes sense.
Yeah.
Okay.
Great. Well, thank you so much. I'm not seeing any other questions come up right now, but I have a feeling there's more discussion topics to be shared. So I can go ahead and download everyone's email addresses from the Eventbrite. And if any of you are interested in getting in touch with anyone else who's mentioned here, I'll just kind of go back through some of the people that we have here. Sarah represents the CAVCM, which is like the VCS of Canada. Dr. Trina is a VCS, Veterinary Cannabis Society, as well as myself. She has a consulting company. Tyler is with Caring Pathways and the IAAHPC, as is Colleen. She is the executive director. She's a big deal at the IAAHPC. We have Dr. Sandra here, who is, other than me, I believe, our only European representative, and some other people who introduced themselves. So I'll go ahead and send an email after the event to everyone who attended, just thanking you, maybe not, offering some discount codes, just watch your emails. And if any of you wants to reply directly to me and just ask for an introduction, that would be great. I know Shalisa has some exciting things. She's actually opening a holistic veterinary wellness center in the Bay Area, and she is looking for people to work with her there. So that's something to kind of put in your back pocket. But thank you all so much. It's really important to everyone here that VCS and the IAAHPC work closely together, because we do encounter so many of the same topics, issues, and problems. So if you have any ideas for future coffee chats related to this topic, even more specifically, we are happy to drill down more and more specific in every coffee chat. We can absolutely do that. And there's other ways of increasing the discussion. Oh, and actually, Tyler is also mentioning that their conference is virtual this year. So if any of you are interested in
be partnering on the conference, there's an option for you as well. Yes. So I'll send an email with all of the links that you can possibly need. And once again, thank you so much for joining us. I do hope to see you in other coffee chats and out in the veterinary world. Thank you everyone for joining today.
Thank you, everybody, for taking your
Thanks,
time.
guys.
Have a good day. Bye-bye.
Thanks.
You guys.
Bye.
We hope that you enjoyed this coffee chat presented by the Veterinary Cannabis Society and the International Association for Animal Hospice and Palliative Care. To learn more information about veterinary cannabis, visit www.veterinarycannabissociety.org. To learn more about animal hospice and palliative care, visit www.IAAHPC.org. Follow these organizations on social media and consider becoming a member for access to more coffee chats like this one and vital veterinary information. Thank you.